Okay, so Dr. Rasheeda, you just mentioned to us the mechanisms. Now, once we have located the issue, how do we approach it?
Good question, Prachi. So there are a number of ways or approach towards these problems. I won't go towards the scientific approach initially. We'll be talking about the generalized approach. So first one is the intervention, the integral intervention which we talk about. It is very general approach, wherein a person, if they come to a healthcare professional, first mental health and the physical state of a person should not be taken as two separate topics.
Okay.
It should be treated as one. Right? So over there, we all agree to it.
Exactly.
Right? Now, if such an approach is being taken, they can give a therapy such as called as cognitive-based therapies.
Okay.
So these therapies are really good for their emotional stresses, as well as it will try to alleviate their physical symptoms too. Right? So that's one method.
Okay.
Second comes a targeted or personalized medications method.
Okay.
Now, targeted method and personalized medication, it goes hand in hand. Now, why? I'll tell you. Now, in both of these, the target is very specific. If a patient comes to me, if I am a psychiatrist, if a patient comes to me, I'll be very specific with that person. I will talk to that person, what problems they have. I will try to take out, it would be a sort of, a very unique approach or therapy towards it, right?
Okay.
Once I identify that what problem or that person is undergoing an emotional or any sort of mental health issues, then I will try to relate it to their physical health, and accordingly I will treat them.
Yes.
Examples if you take, we will usually do a biofeedback for targeted therapies.
Okay.
Or else there is something called as mindful based relaxation therapies which we use, right? Then we even have when we take in personalized medication, you give them a very specific medications which is being approached by a psychiatrist in that point of time.
Right.
So for those people, we have very specific medication. Therapeutically, we treat them.
Right.
And finally, if we talk about, it's called as the interdisciplinary collaboration. Right?
Okay.
Because if I'm a general physician, if a patient comes to me with a physical health or a problem, I might send, if I feel there is some issue with them, I might send them for some scans.
Okay.
Right? And if in those live scans I feel that there is some issue with that person, it would be better for me if I would collaborate with the psychiatrist, a social person who is a social worker, to give that person a good social support. Or I would try to change their lifestyle condition. Because even lifestyle plays a very important role in changing these disciplines.
Totally agree.
Right?
Yeah.
So these are very few of the simple approaches, very generalized approaches which you can take for people once you have identified that there are some underlying issues in such people having, their chronic condition and their emotional stresses.
So these therapies must be a very long-term therapies, isn't it?
Yeah, because we say now once a person undergoes emotional pain or stress, it's not easy for that person. It takes a long time for them to undergo that stress, and to deload that stress also takes a very long time, because they have to have such a supportive group around them. If I am a person, or if I am a individual undergoing some sort of emotional pain, and might be I'm having some chronic ailment, I may have a back pain, because specific emotions are related to specific parts of your body. If I come to you with that, you will take a lot of time pushing that out first from you. Once you push that out, then you'll be able to treat it.
I know.
And that person, if I'm talking to you, you have to be very trustworthy for that.
So you have to develop first the trust.
Yes. So that access to that healthcare is very important.
Exactly. Thank you so much, Rasheeda. This is very valuable to us.
Thank you.